The demand for healthcare providers is very big right now, and we do have shortages in most of our healthcare professions.
The state of Utah is trying a different type of recruiting effort to help rural and underserved areas.
The state will pay some healthcare providers student loan debt if they agree to work in an underserved area of the state.
Fox 13 News political reporter Ben Winslow shows us how it works.
Jared Powell is a licensed clinical social worker who left school in debt.
I was looking at, can I stay in the field? And so when they said, well, we have this loan repayment possibility, it really was meaningful to me.
He works here at First Step House, where part of his bills from school are now covered by the state of Utah.
The loan repayment, to just have the loans being taken care of while I'm in, that was just a real big win for me.
Utah's Department of Health and Human Services will pay some of a healthcare provider's school bills.
You would need to work in a shortage area, commit to 3 years of service there. Your site needs to agree to it, and they'll match 20%.
Depending on the profession, that could be in rural Utah, where some people have to make long drives just to see a doctor or a dentist. For mental health specialists,
almost all of our state geographically is underserved for mental health.
This year, the Utah State Legislature appropriated $1.7 million for this program, and Utah's Department of Health and Human Services is hoping to recruit even more med school students to work in places where they are desperately needed.
The whole goal is to get providers into areas that are underserved. So you'll be serving your time in a shortage area and doing some really important work.
I love watching people heal, being a facilitator and a witness to that. And so definitely did change very much more towards the treatment side of things. And so that's where the loan repayment, it helps me stay.
Powell says he loves what he does.
To watch somebody who comes in with sunken eyes, and hopelessness, but then to see them start to have the flesh fill back out in their face, have a smile, to be talking about their job prospects, to be looking at restoring their connections with their families. Yeah, I'll say it's not glamorous, but glorious.
Ben Winslow, Fox 13 News, Utah.